If you have never had a home physiotherapy visit, not knowing what happens during that first session is a real and common barrier to booking. Let me take you through exactly what occurs, step by step, during a standard initial home visit, so the process is clear before you confirm the appointment. Sessions typically run 45 to 60 minutes for an initial assessment, depending on the complexity of the presenting condition. The first 10 minutes are administrative and preparatory. The physiotherapist will confirm the names and contact details of any specialists or general practitioners currently involved in your care, review your current medications, and note any medical conditions that affect what treatments and exercises are appropriate. They will also make a brief assessment of your home environment, not intrusively, but looking specifically at the things that are clinically relevant. In particular, they are looking for the features of your home that explain your functional limitations, the chair that is too low, the bathroom that requires negotiating a step, the mattress that is too soft to allow easy rolling. This includes the height of your usual chair, the height of your bed, and key transition surfaces like the toilet and car seat, whether there are stairs you navigate daily, the flooring surfaces in your exercise space, and the general safety of the environment for the activities you need to perform. This environmental assessment is one of the most clinically distinctive aspects of home physiotherapy compared to clinic-based care. In a clinic, you describe your functional limitations. At home, the physiotherapist can directly observe them in their actual context. They can see that your most used chair is low, armless, and soft, the exact combination that places maximum demand on the hip flexors and quadriceps for rising, which is the source of much of the knee and hip pain in patients who describe symptoms primarily with the standing from sitting. They can see that your bed requires a significant step up, which is directly relevant to anyone managing post-hip or post-knee surgery recovery. They can observe the flight of stairs you describe as manageable and assess what that actually means for your movement pattern, your pain provocation, and the compensatory strategies you are using. This is clinical information that simply does not exist in a clinic environment. The home visit is the only assessment context that gives the physiotherapist this ecological picture. And for many patients, particularly older adults and post-surgical patients, it is the context where their functional challenges are most relevant and most accurately assessed. The next 20 minutes are the subjective history and physical assessment. The physiotherapist takes a detailed history of your presenting complaint, how it started, exact location, what makes it better and worse, what activities it currently limits, what you have already tried, and what functional goals are most important to you in your specific home context. The physical examination covers the same test as a clinic assessment, medial, range of motion, strength testing, neurological screening where indicated, and specific provocation tests for the suspected structures adapted to the available space. For most home environments, a firm bed, a mat on the floor, or a dining chair is sufficient for a thorough examination. After the assessment, the physiotherapist delivers initial treatment. Manual therapy techniques, joint mobilization, soft tissue release, neural mobilization are applied where the assessment indicates they are appropriate. The first set of exercises is taught within that session, demonstrated, performed by the patient under observation, and corrected before the appointment ends. The session closes with a written or photographed exercise program you can follow between visits and a clear explanation of what each exercise targets and why it is relevant to your specific findings. But for post-surgical recovery, chronic musculoskeletal conditions, mobility-limited older adults, and early to mid-stage rehabilitation in general, everything required can be delivered effectively in the home environment. Home physiotherapy is particularly well suited to patients for whom consistent attendance at a clinic is a genuine barrier. older adults with limited mobility, post-surgical patients in the first weeks of recovery, parents of young children, and those with work or transport constraints that make repeated clinic visits difficult to sustain across the weeks a full program requires. The link in the description covers home physiotherapy services across Malaysia, what to expect from subsequent visits, and how to arrange an initial session.